So yesterday I have posted a question, case 3. The question was, an elderly male who recently underwent emergent surgery. So something is given here, recently, so in an acute scenario, recovering in the intensive care unit, they have past medical history of hypertension, overactive bladder and malnutrition. They are somnolent on exam, retired, provide limited history. Their vitals are temperature 101 Fahrenheit, so they are having what? Fever. Heart rate 108, tachy, blood pressure 134/84, respiratory rate is 80. Their spouse, wife is at the bedside, reports that when the patient was more alert, there was chills also. You review the patient chart and their home medication include lisinopril, ACE inhibitor, right? Antihypertensive, oxybutynin, what is it? M3 blocker, overactive bladder, bladder have which one? Parasympathetic, which one? M3, so you are blocking it. Oxybutynin is what? M3 blocker. Amylase high, lipase normal, lipase, WBC is high, infection, right? People, the students or most of you seen only one thing here, amylase, and 90% of the students answered the question as acute pancreatitis. That's why this question is very relevant, because 90% of people, they only see what? The level of amylase. Very quickly remember, here now itself we are feeding our brain. Amylase is not only the enzyme of what? Pancreas. Amylase is also produced by one more gland, the salivary gland or parotid. So first thing we are saying to our brain, amylase is not only for what? Pancreas. Amylase is also for salivary gland. What is it? Parotid, right? Or remember, if it is acute pancreatitis, what should be also elevated? The lipase should be also what? Elevated. But is it elevated here? Normal. Or the signs like Pullen sign, Great Turner sign, or pain, epigastric pain, something should have given. Any scenario of chronic here, chronic means they should have given malabsorption, they should have given steatorrhea, weight loss, diabetes, anything given here? No, right? Then HIV. In HIV, they should give us what? Multiple sexual partners or B symptoms, right? Like CD4 count is what? Less. Or immune suppression or STD. Agreed? Or B symptoms, weight loss. Here no symptoms are given. Yes or no? So only with amylase, can I go with pancreatitis? That is the motto of the question here. So the correct answer here is what? Parotitis. Inflammation of what? Which gland? Parotid. Hospital acquired means like staphylococcus or strep. Nothing is mentioned here. So let's have a quick review. What we have to know from parotitis. What is parotitis? Inflammation of parotid. Parotid. It will be always unilateral, right? You will have swelling, right? Or pain. There can be discharge, saliva drooling, or there can be discharge. Or maybe, right, this viral, so serous discharge, not purulent. Which virus are very common for parotitis? Good. Mumps. Or it can be which virus? HIV also. Mumps or HIV. In people who are having dry mouth, they are very prone to have it. Or decreased salivation. Why? In this question they are saying you are taking oxybutynin, M3 blocker. So M3 blocker decrease what? They are blocking parasympathetic saliva. So decreased salivation case, you can have what? Parotitis. Or post-operative period, after intubation, or some surgical procedure, we are touching what? The parotid gland, they are getting what? Dried. So you can have chance of what? Parotitis. Or in people who are in ICU, intensive care unit, they are prone, right? Or those who are having cachexia, weight loss, right? Or those who are immune suppressed, or those who are having oral cancer, oral neoplasia, or advanced age. These all are feature of what? Or risk to have what? Parotitis. And what is a marker? Because parotid also produce what? Which enzyme? Amylase. So what do you take away from the question? If you see amylase, you have to think both about salivary gland as well as pancreas. So in this question, all the relevant information for the parotides are given. See, the patient is what? Very elderly. Is acute or chronic? Acute, right? He was in intensive care unit. He was having overactive bladder and malnutrition. For this bladder, we give oxybutyrate. We are blocking what? Parasympathetic. So means the salivary gland are drying. So there is a chance of what? Again, parotitis. And they have reported fever and chills for infection, inflammation, fever and chills. What is very high here? WBC is high. So we are ruling out pancreatitis. No symptoms are mentioned. So the correct answer must be what? Parotitis. So never ever forget. Lifetime, right? Case 3. Thank you.